Hello, Dr. Mark Ross, consultant plastic surgeon, here today because you've asked me to talk about scar revision and who's a good candidate for scar revision. Well, scar revision simply means that an expert plastic surgeon will remove your scar, possibly reorientate it, and then close it up with precision. We normally do this in a controlled environment of a proper operating theatre with good lighting and good instruments. If your scar is unsightly, you don't like the look of it, if it's rubbing on your clothes or getting in the way of your mobility, then we can not only cut out the scar, but by means of fancy plastic surgical flaps, we can reorientate the scar so that it doesn't get in the way of your movement. It's important to realise that a scar takes at least 18 months to settle. So although your initial scar revision result will look fantastic, it will go through a reactive phase for the following 2 months where it may look obvious again before, in most instances, it tends to settle over the following 18 months. Importantly, some scars don't do as well as others. If you have a scar on your chest, on the sternum, on your deltoid, your shoulder, or on your earlobe, those scars are more challenging to deal with, and we may have to use additional modalities of treatment such as local steroid injections and very rarely X-ray therapy. It's also important to realise that certain skin types don't heal as well as other skin types, and in those patients scar revision surgery can be a bit more of a challenge. And also those patients really emphasise the point that there's no scar like no scar. So if you're considering surgery in an area where you might scar prominently and you have a skin type which is unacceptable for scarring, be very, very cautious. I'll of course go over these factors with you when you come and see me. Most scar revision surgery will be covered by ACC or possibly your medical insurance provider, but if not, I've got good news for you. We do have an interest-free payment plan. When you come for your consultation, I'll show you before and after photos of my work, and you can see many more photos of my before and after work on my website. Look forward to seeing you.